Welcome to Docnur. How much information should the hospital disclose when a patient or his legal representative asks for medical records? A female patient was treated for epilepsy at a medical institution in Kerala. She died after treatment for 14 days. The father of patient applied for release of copies of all medical records of the patient. The hospital denied the release of all records, stating that the case summary, discharge records, and investigation reports were already given to patient's husband. This denial was contended by patient's father in High Court of Kerala through a writ petition. He referred to IMC Professional Conduct, Etiquette and Ethics Regulations 2002 and claimed that not only he is entitled to a statement from doctor concerned, but also copies of medical records maintained by the hospital under section 1.3.1, 1.3.2 and appendix 3 of the regulations. The hospital maintained that records referred to under regulation 1.3.1 denote the certificate in form of appendix 3, which contains all the details, and that had already been issued to the husband of deceased patient. On review of said regulations, the court observed that the details to be provided under appendix 3 are comprehensive in nature. Here, information pertains to diagnosis, investigation advised with reports, diagnosis after investigation, advice, and that too on a periodic basis. Naturally, a doctor will advise this to the nursing staff in the case sheet itself. Reading all these sections together, the court interpreted that documents referred here necessarily have to be entire case sheet maintained by the hospital, and that the regulations recognize patient's right to receive documents related to his or her treatment. The court pointed out that regulations do not provide any immunity to a medical professional or a hospital for retaining medical records of a patient. Rather, expressly provide for their release to the patient. The hospital contended that documents once furnished will be used as evidence against the hospital and doctors concerned. The court denied this apprehension, stating that if proper service was rendered in treatment, there should be no fear of litigation, and transparency is a patient's right and recognized by medical council regulations. The hospital was directed to hand over true certified copies of original medical records. In short, if there is nothing to hide, there should be nothing to withhold. Looking at current trends of these practices, we recommend that patients should first ask for their records with a written request, and doctors and hospitals should release the true copies of original records within 72 hours as prescribed by MCI regulations. I hope you found this video informative, so don't forget to like and share, and also subscribe to be informed on the critical issues surrounding medical practice. Thank you.